slides are okay? Great. Sorry about that. So we at Capacity for Health are funded by the Centers for Disease Control and Prevention to provide free trainings and one-on-one capacity building assistance to community-based organizations. We work in a wide area of content. We do work around organizational development, infrastructure, program development, sustainability. We also do a lot of work around the evidence-based interventions and public health strategies. And today's webinar is part of our work on monitoring and evaluation. We are very pleased to, let's do a little housekeeping before we start. Just so you know, you're all muted automatically by us at our end of the webinar. If you have any questions that come up during the presentation or you're having any technical trouble, please use the questions feature to type those in, and we will respond by typing back. And there will be some discussion sections of the webinar at the end of each of the content areas as well as at the end of the presentation. And during discussions, we'll remind you to raise your hand, and then we can actually call on you, and you can participate live in the discussion. So we're very pleased to have with us today as our presenter, Lynn Palaio. She is an MPA and also a DRPH. I've been working with Lynn for almost 6 years now. She's an amazing evaluator. She's also the evaluation manager for Contra Costa First 5. We were chatting this morning, and she told me that she's been doing evaluation work for about 18 years, and she thinks she has probably guided the development of over 500 logic models. So we're very, very pleased to have her presenting with us today and to tap into her expertise. I'm actually going to go ahead and pass the audio over to her so we can start with the presentation.
Good morning. As Sonia said, this is Lynn Palaio. I've been working in nonprofits all of my life since 16 years old, except for some brief stints in factory work and the other kinds of things. I'm sorry, this is my first seminar, webinar seminar, so it's very hard to not be able to see you. I'll get used to that in just a second. I've had a lot of experience with AIDS and HIV starting in 1983 when I was the fourth person hired at what became the San Francisco AIDS Foundation, and still follow the field of AIDS very carefully. I've branched out into other kinds of content area as well, such as homelessness, substance abuse, youth violence prevention, and other fields for my evaluation work. Today we're talking about logic models. 4 categories of the content will be presented today. What a logic model is and what it is not. Formats for logic models. Using logic models for evaluation and presentation, and then contributions from you and questions. So, basic question, why create a logic model? I usually hear 2 answers to that. 1, our funder makes us, and 2, we find it useful for program planning, evaluation, and communication. Frankly, both of these are just fine responses. I particularly like the second, but I do know why funders want logic models. They're very helpful to the funder to have assurance that the program has reasons for doing these activities and that the funder's money is well justified to the funder's stakeholders. I think that there's a lot of use for the programs to use logic models, and that's what my focus will be on today, is how it's useful to people who are providing the program services. So first, what is a logic model? I think most people have seen a logic model at this point. They come in lots of formats. Some of them are better than others, and we'll kind of critique some of those formats as part of this. I'm just going to pop through a few of them so you can see there are so many kinds of structures for them. Kellogg really launched it. I don't think they invented it, but they really launched the popularity of logic models in the foundation and nonprofit world in about 1990, I think. The basic notion that they had at the time that still carries through today is that there are certain resources that are needed to operate a program. If you have them, then you can use them to accomplish your activities. If you do your activities, then hopefully they will produce something, whether it's a number of workshops or a number of brochures or the number of people recruited. If you accomplish your activities, sorry, I'm getting used to the screen, getting a little technical assistance here. The red arrow? If you accomplish your planned activities to the extent that you intended, then your participants will benefit in certain ways. And if those benefits to the participants are achieved, then certain changes in organizations, communities, or systems might expect to occur. And that's a tall order, too, to say, gosh, through our work, we're going to really change communities and organizations. But I bet that you know from your work that, yes, that is what we're doing. I think logic model is central to program evaluation and use of the results of the evaluation. I really put it in the center. And I know that many people I start working with on logic models would rather have it off the page altogether, and certainly not in the center. But let me tell you why I think it really ties everything together. I know you know that there are needs out there that we want to respond to, things that we want to solve or ameliorate certain problems or improve the conditions of people's lives. And if we can get the resources to do that, then we come up with a program description. Frequently it's a bunch of people sitting at a table saying, gosh, we could do this, and that would really help. We've been doing these other things. We need one more new piece, so let's design a program for that. At that point is when a logic model really comes in handy for people to start documenting, what do you think the goal is? Why are we trying to do this? What are we hoping to achieve? What are the activities we're going to do? One would go on the left, one would go on the right, and then the rest of the session is to fill in the gap in the middle of how do activities lead to those goals. The logic model can really reveal a lot about, gosh, maybe we don't need to do this set of activities, but we're not doing enough of that because this set of activities won't even lead us to these goals. So with a good logic model and good staff resources and everything else that's needed, the program services are launched. There is hopefully an evaluation at the same time, and there are findings. I'm going to show at the end of this presentation today how the logic model can be used in and of itself for presentation and communication of those findings to make it easier for those who need to, such as program managers, to decide whether to continue the program, modify it, try something else, or replicate it to many other sites. So, okay, what is a logic model? It's a diagram. It's just a diagram that shows how the resources of the programs lead to the desired impact of the target population. And this would be the funder's point of view, is how do those dollars, those investments, lead to the kinds of changes that our board is going to support. For the program planners, it shows more than that. It shows the relationships between those resources and the activities and the results. So it's the difference between the second and the third and the fourth column that program designers really can look at. And then it provides a common approach for integrating the planning, the implementation, the evaluation, and the reporting, because everyone can point to kind of one document as the launch pad for all of those activities in discussion. So a logic model is not reality. Reality is way too complex to document in a diagram. It's a simple model that represents program intention, and it's not even complete. It doesn't display so many things. It, first of all, doesn't display usually the factors that influence the program that are outside of the program, things like cultural barriers or environmental barriers or the winds of change, the political culture. And it doesn't prove causal attribution of the intervention to the change. So many people would love it to say, we caused that change. A logic model no more than any other form of evaluation that nonprofits are likely to take on for under $100,000, none of those tend to really be able to justify causation, that we did that. Some can come close, and when one can, that's terrific. But the logic model itself is not really a part of that as much. And here might be a surprise to some people. It's not a theory of change. We frequently call a logic model a theory of change, but I would assert that it kind of isn't. It relies on social theory or other theories of change. And I'll come back to that in just a moment to explain what I mean for both those people who don't know what a theory of change is and for those who do. And finally, it doesn't address, are we doing the right thing? Because people will have to use the findings and their knowledge of the program in order to decide whether it's the right thing. That is always the hard question, isn't it? There are different formats to an impact, to a logic model. Some people make a distinction between impact models and logic models. I do myself. They are slightly different. Impact models are very closely related to logic models, but they're more specifically focused on the shorter steps between the short-term and the long-term outcomes, the middle columns of a logic model. They spread those out, and they talk more specifically, they diagram more specifically, how do those short-term outcomes lead to other short-term outcomes that build on things that can lead to skills and changes. They are useful because they can make the theory of how change happens more obvious by showing the little stepping stones across the river as opposed to just jumping in a big fashion from knowledge leads to behavior change, which is, as we know, a pretty big leap. The basic thing is that logic models have lots of text boxes and lots of arrows, while logic models have a little less detail, but they're still quite useful and easier to construct and easier to explain sometimes. So let's do a poll. Our first poll. Oh, sorry, thank you. Let's do the second poll. Have you ever heard of a social theory of behavior change, such as a health belief model or stages of change models? Many people I found who are working in the field of HIV are more likely to know about these models than persons working in other fields, such as criminal justice or environmental change. So I would like to know how much you know already so I can know whether to skip ahead because you already know something or to spend a minute longer. Yeah, please open it up. Okay, so we can close that poll now. I hope you've had a chance to respond. Most people are saying, yes, I know about stages of change. Fantastic. I'm so glad. 22% say no. And no one is saying, what? You're kidding. I invented them. Which is good, because if I had to talk to somebody who actually invented this stuff, I would be a little intimidated. But I'm glad that people do know about it, and it really confirms what I've seen in so many other cases as well, that in HIV, we're kind of special in how we connect theory to our activities. It might be because of the early and intense involvement that the CDC has had with programs directly, unlike many different kinds of federal funders who don't have as much direct dialogue. So let me just touch on it and give my explanation in a nutshell of this, logic models and theories of change. My screen has gone hokey. I'm going to ask if, oh, beautiful, if you all were seeing that, but now it's been fixed. Thank you to our technical folks. So as we've already said, or I've said at least, a logic model displays the relationships between the activities and the outcomes. But it does not guarantee that that relationship is meaningful, strong, or true. We can say, smoking is bad for your health, and all of a sudden, everybody stops smoking. That happened, I think, in 1967 that they started putting warnings on cigarette packages, and many people did quit. It was like, oh, okay, government says it's dangerous, I'm quitting. And many people didn't. So there is not a completely strong, true relationship for everybody between, say, knowledge and behavior change, or the second column and the third column in a logic model. We anchor logic models to a theory of change that provides the rationale for how that set of activities can lead to the set of short-term outcomes, and especially how those outcomes can lead to long-term outcomes or impacts. The logic model diagrams it, but we need a little bit more to let people be able to trust it. Essentially, I'm suggesting here that the theory of change describes the arrows that connect these boxes together, or describe the movement from one column to another in a table format of a logic model. We can say, for example, that you teach a bunch of teens about cooking and give them free food to cook, and the teens eat better and they cook for their family every week, and that is going to have improved nutritional health for the family. Nice diagram. How much do we believe it? If there is research, and this is where we rely more on the research folks who have the ability to investigate the connection between longer-term or intermediate outcomes and impacts, to see, is there a relationship between teens cooking for their families every week and the whole family adjusting their nutrition? Does that really happen? So some of these theories, let me just back up for one moment. The things that explain these arrows, the theories of change, frequently are, especially in HIV, theories of behavior, theories of social theories of behavior change. But they also might be other things. They can, in fact, be the really experienced program person who is really very familiar with a particular kind of intended population's experience of why one thing leads to another. So it's not always academic or scientific. Sometimes it's experiential based. But some of these theories of change are the health belief model, stages of change, locus of control, social learning. These are the ones that are more popularly used among, well, HIV prevention providers in particular. There is in the resources that will be available to you after the webinar a link to a page that describes these in very clean language. It's listed at the bottom, but we'll send it to you. So I want to show how this could play out. The health belief model, which is perceived susceptibility, people think, oh my gosh, that could happen to me. Oh gosh, it's serious. Gee, maybe I could take some action and it would help. How to reduce the barriers to taking action and continued cues for that action is the essence of the health belief model. Here's a diagram of how it plays out perhaps in reality. The staff, starting in the upper left, distribute information cards about diabetes. Some of the senior residents become aware of the risk for diabetes, so they sign up for a workshop. At the first workshop, something happens, and they become aware of the seriousness. Another workshop, and they learn about the benefits for taking action. Another workshop, and those barriers are reduced. And finally, the workshops are over, but the staff sends monthly newsletters, which are cues to action. Seniors' nutrition is improved, and risk for diabetes is reduced. This is a model, a program that was based specifically on this model of social theory. They planned the topics of each of these workshops specifically to respond to those underlying steps. Not all programs do this, but when it's possible and when it's appropriate, it can be of benefit. So let's talk about the logic of, I don't have my notes up on the screen sometimes. We're ready for our final poll. Does your program rely on a social theory of behavior? Should we close the poll now? %70 say yes. Wow, I am surprised. You all are terrific. I am really impressed with this group of people who are listening on this webinar. No one says, what? Forget logic models. They're just a waste of time, sort of. So that's fantastic that 70% of the programs are really relying on logic models. Let's go on with the next slide. Thanks so much. So the logic of logic models. This is a pretty rudimentary logic model, obviously. There are some workshops. That leads to increased knowledge. That leads to increased condom use. And that really leads to a reduction in HIV. Is this a good logic model? Is the theory of change that supports this a good one? Does increased knowledge really lead to increased condom use, even some of the time? And does increased condom use lead to reduction in HIV, at least some of the time? I would say the second arrow, the one on the right, is a lot more justified than that first one. It usually, as you know, takes a lot more than just knowledge to lead to some kinds of behavior. Plus, you need to make sure that the strength of the intervention is strong enough to get the result you need. One workshop is not going to change people's lives, unless it's a really compelling workshop, perhaps, and they don't have very many barriers to overcome. It needs to usually be a very strong intervention, intense, sustained over a period of time. Let's look at another one. So this one I would say half and half. Kind of there's a theory of change that supports it. Let's look at this one. Workshops lead to increased knowledge, lead to decreased personal aggression, which leads to world peace. How strong is that? I bet if I were looking at you, most people would be saying, no way is this a strong theory behind that logic model. The arrows in green do not well support the connection between those two boxes, especially between decrease in personal aggression and world peace. Boy, don't we wish that it were true. Now, we did not look at research to know just right away that no way, this is not going to happen. The first box, the first arrow from increased knowledge to decreased personal aggression, yeah, that is possible, which is just the opposite from the previous one where we trusted the second arrow more than the first. With this one, we trust the first arrow more, that knowledge might lead to decreased personal aggression, especially if it's coupled with meditation, conflict resolution, and those kinds of things. But almost anyone can just look at this and say, this is not a logical model. Experienced program planners know a lot about what works and what doesn't on complex models, more complex than this one. There is a real benefit to logic models for people who are designing programs. I've worked so many times with people who are running a program. They've written the grant application. They really know what they're doing. And when I start talking to them and start sketching out on a napkin or a scratch piece of paper what they're saying, putting their activities on the left, their goals on the right, I sometimes drop what seems like their longer-term objectives in the middle and kind of work around what they say and just keep asking them questions. They see things that they hadn't seen. This is from an example of a Kenyan program to offer nevaprine, I might be mispronouncing that word, and breastfeeding support to reduce HIV transmission to the babies. So they spent a lot of money on local outreach. Workers were trained in the community. Plus, their staff got some training. The purpose for the local outreach workers was really focused a lot on education about condoms, but they also encouraged women to come to the clinic through that peer-to-peer network system. So between having staff who were more skilled or compassionate, more culturally appropriate staff, women accept the service by this logic model. So they do receive the intervention, and then because of that, there are fewer HIV-positive babies. On the side of that, because they're compassionate staff, they're giving vitamins because they have the resources, and this was one of the major objectives of the program, and the vitamins lead to healthier babies. And then also there was a lot of work on the condom education leading to condom use, which leads to fewer pregnancies, which in a roundabout way does lead to fewer HIV babies because it leads to fewer babies in general. But they thought that their main objectives were education about condoms and vitamins and nevaprine were all on an equal level. When it diagrams of how what they're doing gets to their main goal, you see that the top and bottom streams are not central to how they're getting there. They're certainly good things to do, no question, but the people who sponsored this program just saw it for the first time when it got diagrammed. This is another one, just to glance quickly, when you put them into impact models, you can sometimes see that there are rivers of activities. There's, in this case, a top river, a middle river, and a bottom river that don't come together until very late in the game. So in this case, if someone were conducting the advocacy outreach to get members to gain leadership skills, it was not leading to children of being active in class, and they were quite surprised until we diagrammed it, and they went, oh yeah, they're not even on the same river. So there's no one way to format a logic model, but there are at least 5 ways to format one that makes it hard for other people to understand. The first one is the everything leads to everything format, which puts everything all in one column. All of the activities lead to all of the outputs, lead to all of the outcomes. The problem with that is it's a bit old school Kellogg. Kellogg has advanced too, of course, everyone has. I mean, after a decade of this stuff, we all know more. Logic, this doesn't use the strength of logic models, the ability to show that there are particular activities, sets of activities that lead to particular short-term outcomes. Second, there's the everything leads to every which way form of the logic model, which is a jumble of arrows. It's difficult because it would take a lot of dedication and concentration to slog through this format to understand what the program designer's logic is. It does differentiate what activities lead to which outcomes, but boy, you still have to map it. You have to love Sudoku puzzles to want to work your way through this one. It's not a good communication tool. The more said, the better format. Whoops. I lost my arrows. Thank you for taking the time with me on my clumsiness with the keyboard. This is only one of 3 pages that looked like this. It went on and on with so much detail. And this is for a program that had like 1 staff and a few part-time outreach workers with this amount of detail, 3 pages of this. This is the more said, the better format. It was actually great because the person who had sort of a scattered description really had to firm up their description in order to do this. But again, it's not a great communication tool. Some of these outcomes could be more effectively combined. Another model is the few words explain everything, and particularly just verbs and objects with no subjects. Here's one where their investment in college student scholarships leads to the students doing community service, mentoring, and financial reinvestment, which leads to an empowered future leaders reduce poverty. That's a pretty big jump. There's not very many words in here. In reality, they had a lot more detail and it expanded this logic model, but I'm just using it for demonstration purposes. It doesn't explain enough. And finally, the exuberant use of color enhances understanding format. It strikes the eye with a lot of bold colors. What you see here is pretty much just colors, and you can't even dig down to see what the outcomes are. It can be useful for interagency communication if it's a part of a coalition because everybody knows what everybody's doing, but as a presentation tool, it's blinding. So here's some tips. Try to make it easy to understand, make clear who does what. Really, I can't emphasize enough the subject-verb-object format for stating outcomes. Decide what columns your model needs. and try to achieve a balance between showing enough detail and not too much detail. There are three kinds of structures of logic models that nonprofits frequently want to have, and they're different structures in what the outcomes columns might be. So let me spend a little bit of time walking through those. One of them is when a program has face-to-face contact with the recipients or beneficiaries of the service. Another is the advocacy kinds of programs, and another is social media. So let's start with that first one. This could be a prevention, it could be direct services, it could be anything as long as staff get to actually see the people that they're providing the service to. Short-term outcomes tend to be changes in the heart, head, and gut, essentially, things like awareness, knowledge, attitudes, opinions, aspiration. Medium are frequently behaviors and skills, and then long-term are changes in whatever they are, whatever field. It's essentially change in well-being in whatever field they are. This is an example of that. Look at the second column, the third column, the purple. Providers gain awareness of this, and providers and clients increase knowledge of that, and the skills and behaviors functioning increases. So you see, it fits that kind of logic model of knowledge and awareness leads to skills in behavior change. And do notice it's subject, verb, adjective, or object. Partner gains awareness. Client does this. It really helps to say that rather than just increased use of HIV condoms. For social marketing programs, it's a little bit different. The short-term outcomes tend to be things about awareness of the campaign and understanding of the message. Do people even get it? And the social marketing campaign then might lead to changes in attitudes, opinions, motivation, etc., which hopefully in the long term leads to pretty much group norms around behaviors in whatever area one is working with. This is an example of one where the first part, this is where the stuff in orange is where this style of logic model differs from the previous direct contact one. Buzz about the campaign, aware and understand the campaign messages, and to the right, positive buzz for the physical activity among tweens. So those are some features of a social marketing campaign that are different. And finally, policy and advocacy programs. The short term are frequently media contacts. Are we making them? Do we have our messages? Are coalitions developed? Medium, the media representatives come back to our organization for the backstory. We are a trusted source. There is media coverage. The collaboration builds, coalition builds capacity. And long-term regulations or laws are passed. This would be an example of a logic model along those lines. There's an excellent website listed in the resources that this is taken from that lets one really see what other kinds of inputs, activities, and outcomes would be available and logical to use for an advocacy project. So in your choice, one of the things you need to decide is, do you want to use an impact model or a logic model? You can start with one and go to the other in whichever direction. You just kind of have to think, what is my need? What format would work with my group of people? Then you need to look at what is in that first column. By Kellogg, it might be problems, it might be resources. I'm sorry, I didn't mean to say Kellogg. In practical use, it's, come on down, little key. Didn't link. Broken. Here we go. Just look at the top row in blue. In this logic model, the person used a problem statement for the first column, and then key strategies, and then what we might call process or process objectives. It's a great logic model. It really shows a wonderful amount of information. It's just structured differently because they found that they wanted to show their problem in the first column that they were dealing with in order to let the other columns answer whether that problem was being effectively dealt with. In this one, that first column is the resources, activities, outputs, outcomes, and impact, a much more traditional kind of model. It also is just fine. All I'm saying is do not be constrained by formatting to insist that everything has to be used with these specific columns. Of course, you really need something about activities and outcomes. That would be the bottom line. But what's between there is up to the people who are writing this, usually the program designers. Activities or inputs, inputs are usually resources. I sometimes think maybe the funder wants to know what the inputs are. So if you're doing something for the funder, especially a funder who's looking across 45 programs and wants to see, gosh, is this amount of effort going in with 2 paid staff or 25 paid staff? Because this program done on 2 paid staff is too ambitious, and it done on 25 paid staff, it's not ambitious enough. So it helps to see the level of kind of resources that go into that. A second issue is whether we need both activities and outputs. Sometimes yes, sometimes no. Sometimes the activities just state it. And do we need outputs? Or I've been using something a little different lately in the work that I've been doing, which is to say units of service and population reached rather than outputs. It's basically 54 families are enrolled, 20 new families are into RAP, there are 350 meetings, that's the service. So that can be a terrific way to not have to talk about factory, let's get to the most. That can be a terrific way to not have to talk in factory terms of inputs and outputs and that sort of thing, which I find kind of off-putting because it implies that people are too much like machines. So here are some row headings of some of those choices of what might be in those outcome columns. There can be a very number of them, and they could be pretty different what you want to write under them and structure it. I want to talk for a moment about the connection between goals and objectives and impact models, because both formats are still in use by funders. I don't think one really needs both of them, although the belt and suspender kind of funder might want both of them. Or you might have multiple funders, some of which want one and some of which want the other, but they're inextricably linked because this is all based on, models of programs. So in a logic model, staff does something, people change in the intervention. The change carries over into their lives beyond the program, and it leads to an achieving goal. The staff doing something is the basis for process objectives. So whatever you have in those boxes, just write them into the language of a process objective or vice versa. The outcome objectives, the short-term outcome objectives, are what changes happen during the intervention. So you can write them as outcome objectives or as outcomes in boxes or columns. And the same is true for follow-up objectives, which we might call intermediate objectives. And then the goals are also a lot like the impacts. So you can move fluidly from the objective format to the outcome kind of format. We know how outcomes are usually written. By X times, so many clients will increase the ability to do whatever. And that's the basis of, one moment please, of this kind of thing where a certain number of people do things with these changes in knowledge. Let's look at just a couple of those that are in purple and blue right in the middle. In this, the partners of gay men with mental health diagnosed problems gain awareness of the couple's strengths and are able to identify the informal strengths. And something happened that this became fuzzy. So I'll just talk you through it. Let's just take that first one. To turn that into an outcome objective, just put it in that language. By June 30th, 2012, 75% of the partners of clients will increase their awareness of the couple's strengths. Or for the second one in purple, partners of men receiving the wraparound services learn about positive support practices by June, yada-da-da, 75% of partners have knowledge of positive support practices. So you can go back and forth between the two. Should we state the expected amount of the outcome or objective? This is a question that I don't think there's any controversy in terms of stating the expected amount for a written objective. For example, a minimum of 75% of the estimated 45 participants in this service will choose these options with this outcome. That's pretty common. Some people want to put those benchmarks into outcomes, into the logic model boxes. I suggest don't, because a logic model is a theory of how things change. It's not trying to describe in advance how much of that change. Leave that to the evaluation to find out how much change, and then decision makers can decide whether it was enough change. Let's move to evaluation, how to use logic models for evaluation. This slide, which is being sent to you so you can refer to it in more detail after the presentation if you wish, shows the evaluation question for each of the parts of the logic model that one can ask, and gives some indicators of how you might know that those have happened. I think it's easy to use this kind of thing for people who are not as familiar with developing evaluation questions. And if you ask them, what do you want to know about your program, they'll start talking about a lot of things, some of which are really grand theory that would take $1 million research study, and others are pretty pedestrian. Using this format and using it in a group with a piece of paper right there and having people start writing what do they think to fill in this can be very, very helpful. So let me talk for a second about how you write these logic models. Together, usually. I have written them based on proposals only. I received a stack of proposals from a funder and built a logic model for each of the programs. There were 15 of them, and went to visit each of the programs, set down the logic model on the table, and I said, this is definitely wrong because I did it from your proposal and I couldn't have gotten it all right, so let's look at it and revise it. And they found that so much easier than being faced with the task of writing a logic model and then frequently having it rejected because it either has too much detail or not enough, and having it not be useful for lots of evaluation because what do you do with 16,000 objectives between the 15 programs? So by my writing the 15 of them, I could at least get all of the outcomes kind of on the same level. These were programs, one of them was a food bank in Fresno, and they just got a grant to expand their food van service. That's what they really wanted. So they had to justify it by some kind of healthy eating, active living sort of project of educating people in the places they stopped. So that's what they got the grant for. Did they want to stop and take the time to write a logic model? I visited them. That place was a warehouse of activity of giving out food. No, they didn't want to stop and do a logic model. They were really happy to check in with the one I drafted and then revise it. So I would suggest that. You can do it either if it's a small group, right on the table with scratch pieces of paper. I like to do it on scratch pieces of paper so no one takes it as really formal. Or on a blue sticky wall. If you haven't heard of blue sticky walls, do a web search for blue sticky wall. They're essentially a piece of lightweight tint plastic with artist spray, and you can take ordinary paper and it will stick right to it, and then you can reuse it. I've had mine for years and it still hasn't worn out. Those are a couple of the techniques for writing logic models, and I would love to do more. I'm going to completely skip over the methodologies then, except to say that logic models and impact models really help identify which things you want to evaluate, partly because everyone can look at it and say, yeah, let's do this one. If we acknowledge that we can't do it all, then you pick and choose which of these outcomes you want to try to have some evaluation of based on whether it's really an important one and whether collecting the information is feasible. You balance those two. You try not to do everything, just choose whichever ones you think you can do on the resources and skills that you've got. and then describe what you have. Even though you haven't done the evaluation of every single piece of it, having it as a logic model gives more credence, because if you can find some things about one box but not quite another, but you can see how tightly linked they are, then people are more likely to believe the second box, which wasn't evaluated, because of the logic model structure that helps you believe it based on the first box. Developing a logic model, this is the logic model. And let's look at that first box under units of service, which is what I use as the term for outputs. The logic model said 54 men continue to be involved in wraparound service. And there are 360 facilitated client partner meetings and then some outcomes. A way to present this to the board or a group or a community group or even yourselves is by doing the same logic model with links for the true number. Actually, it wasn't 54. It was only 51. Now, this report, I'm linking to a report that was for another topic because I made up that logic model and I didn't write a full report. But pretend that there's a technical report of about 50 pages here, and one piece of it is talking about why it was only 51 and not 54. You can write that text in your technical document, and the person can see it if they're reading it on screen in front of a presentation, or you can email this to them, and as long as they have them all in the same file, then they can do this on their own. So 420 facilitated client events. Let's see what we know about that. You have to use a leap of imagination here to pretend that this is telling us about the 420 facilitated meetings. I'm merely presenting the structure to give you an idea of a pretty new way, at least I haven't seen it used much, of really simple technology. We're not talking about purchasing any programs that you don't have. This is all just Word and PowerPoint. That's all it is. Just read the little help section on hyperlinks and bookmarks. And then finally, whoops, I have a link here for 80% of the partners have this outcome. Here's the brief thing, which I'm not going to go over now. I just put it in there so that you would have it if you download these resources. So that was a whirlwind, and my goal was almost achieved of having some time for discussion. And thank you for bearing with all of that flood of talking. Let's open it up to you all. I would like to hear what your thoughts are, if you have any questions or comments or discussion. We're here. We're ready for people. Oh, raise your hand if you have a question or a comment. If there aren't any, then I'm going to continue to talk for a little bit longer. One of our folks will give me a cue if there are any comments. Feel free to ask them. We're now reviewing everything that you have just learned. I hope you got this review. I would love to be able to work with people on how you can better design a logic model with a group of people who aren't familiar with them and don't trust them. What I've heard many times when I go places to nonprofit organizations, folks say, oh yeah, we worked on a logic model once. It was the most horrible experience. I hope we never have to do that again. We spent months on it and it never resulted in anything. And my response is, I am so sorry that you had that negative experience. With a person who likes logic models and can talk nonprofit kind of language and service provision kinds of language and keeps it pretty simple, creating a logic model can be pretty fun and pretty easy to do, at least the draft of it, and then refining it and sending it back. Frankly, I find it as easy to do by just sitting down with somebody and saying, tell me about your program. Oh, well, we funded this program to because we've had all these problems in our clinic with in our mental health clinic with a lot of gay men who are still engaging in risk-taking behavior, and our staff, frankly, just don't know how to respond. So we started this program to bring in staff who really do understand the community to provide good services. Yeah, okay, I say, that's great. I'm glad you have this program. It sounds like it's important, but what activities do you do? A personal talk for a while and maybe ramble on to, oh, well, we do individual and group counseling for the client, as well as support groups and group counseling for the partner and the family of choice. Okay, now I know what your activities are. So then you just start. What do you want to have happen? And it will take a while for them to get a cogent sentence of what they want to have happen. And then you can fill in the middle. We have a question. Would you go back to linking logic models to process outcome objectives? I would be happy to. If you feel like providing a more specific question so that I can know what you'd like to know about, I'm thrilled to do that. Let's go to that slide of linking process. I'm sorry, I'm getting two hints. Go back to linking logic models to process outcome objectives. I'm thinking that you're talking about this slide, and if you're not, just enter a chat box. Great, thank you. She said this one. All right, let's just start. The old school, and probably still true, is that grantees wrote process objectives. By June 30th, whatever, we will provide 250,000 brochures and distribute them. We will host 15 rallies, and we will conduct 32 door-to-door campaigns. And that was about all that was needed. Then funders started saying, yeah, okay, I'm not really comfortable. I need outcome objectives, like what will this result in? So then people started writing things like, by June 30th, 22, you'd write the same process objectives, but they needed outcomes for those. Too bad I chose such a difficult example in my own head. By X amount of time, 32 of the neighbors in this section will join a neighborhood watch group. That's a pretty specific outcome objective. Short term, really good, but at least you know that people are involved. By June 30th the next year, a coalition of neighborhood groups will meet at least 4 times a month and create safety plans. Woo. So those are outcome objectives. They're written in that formal by X percent. They're written in this language. By whatever, some amount of the whatevers will something to achieve the goal. That's objectives. The outcomes would shrink that to say, forget the by, forget the how many, definitely keep the what and will and what. So say the outcome objective with that would be increase neighborhood participation in neighborhood watch meetings. Got it. It doesn't say how many and by when, because it's just a logic model that says this is how our organizing leads to neighbors becoming involved in their community. I'm not sure what else you would like to know, but if you have a specific question, I would be happy to go on. Until that, let me just say one other thing about what I think about outcome objectives, even though it's not exactly the topic for us, and that is one of the common mistakes I think that make it very difficult for evaluation and for justification of the program is when people say knowledge will increase by 50% or skills by 50%. It's much better to say 50% of the clients will increase skills because you can tell that. I don't know if somebody actually increased their skills by 50%. I know they do 50% better on my test, but my test is not the whole domain of that skill. So just a little warning there on outcome objectives, and it makes it also easier to do evaluation and to write the outcomes. So let's wrap this up. Let me just flash to, oh, I have one more question. I've read that objectives should not include outcomes. I've read that objectives should not include outcomes. Since the outcomes will be listed, why would the objectives be written in this format? I don't recommend funders requiring both the formal written outcome objectives and outcomes listed in a logic model, one or the other. If there isn't a logic model, I think funders often want to see the objectives including the outcome. By X amount of date, 452 people will increase their knowledge of X. But with a logic model, I'm not sure that you might need to say in the narrative when you think some of these outcomes would happen. But I wouldn't suggest you're just listing the outcomes, increased neighborhood skills and that sort of thing, outside of the context of a logic model on a piece of paper just as a list. They don't make a lot of sense. But within a logic model, they can be quite useful. So I want to thank you for attending this webinar. We have available to you shortly a version of these slides. I've got some sample logic models, some sample impact models, and some templates, both in Word, Excel, and PowerPoint, that you can use to start filling in and adjusting and revising your own logic models. If you want further resources, here would be the website to click, and Sonia, who is leading these workshops, can address any of your questions.
Thank you so much, Lynn, for sharing your wealth of knowledge and experience about logic models with us in today's webinar. We are going to go ahead and close out the webinar, but as I said at the beginning, we are also available here at Capacity for Health to provide individualized capacity building assistance. We do trainings, we do consultations and coaching, we do materials development. So please feel free to get in touch with us. My telephone number and email is listed on your screen, as well as the website for our project, Capacity for Health. And as Lynn said, all of the resources that she mentioned, as well as a recorded version of today's webinar and the slides, will be available on our website. We also did email out to the participants who were registered for this webinar about half an hour before we started. We emailed you out already a PDF of the slide set. So hopefully those resources will be helpful to you. Lynn has also agreed to stay on for a few more minutes if there are further questions, so I will pass the audio back to her in just a minute. But thank you again to everybody for joining us. I know it is 12 and people need to go, so if anyone would like to stay on with further questions, we'll stay on for a few more minutes.
Good. No burning questions. I appreciate that. And if you want to give any feedback or you think something that I said was so controversial that I should be made aware of it, please let me know. This is always, or it should be always, a dialogue among people. I know from looking at the polls you all have a lot of experience and a lot of experience in these same issues, and I would learn from you. So feel free to email me at the email listed here on this screen. I would enjoy that. Thank you. We're going to close out the webinar